Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and we're very delighted to have you with us. And I'm so happy to have as my next guest Nurse Joni Dorey, CNOR, RNFA. Joni, thanks so much for being here.
Thank you so much for having me.
Well, Joni, I want to start off by talking about all those initials after your name, and I want to educate our listeners and viewers about what you do, what operative nursing is like. We'll talk a little bit about plastic surgery nursing, what it's like to go to the operating room, what it's like in the office. So I'm sure our audience is interested in this stuff. So Joni, let's start off with the CNOR. What's that mean? Can you tell us?
CNOR stands for Certified Nurse of the Operating Room. And it's a specialty nursing. It requires that you have a few years experience in the operating room, hopefully as a scrub nurse, circulating nurse, and are very familiar with all the equipment in the operating room, how to sterilize equipment, just about all the basics that go on in the operating room, sterile procedure and so forth. And just like any specialty in nursing and the medical field, it's a pretty intense test that you have to take, written test that you take, and you don't qualify for that test until you've had a couple, I believe it's 2 years in the operating room. And then if you pass the written exam, then you are certified nurse of the operating room. And that is, the testing is put together from AORN, which is the Association of Operating Room Nurses, which is a huge organization, and they're very it's a very classy situation that they have.
And it's very high standards.
Very high standards.
Seems to me to be, you know, just they don't let anybody become a CNOR, and they don't let just anyone become part of the association of the operating room, as far as I know.
That's correct.
So Joni, I know that now you are a plastic surgery nurse, and you work for the esteemed Dr. Doug Sunday here in town. And you know, Joni, you know I think Dr. Sunday's terrific, and we work together a lot. And you know that I think you're terrific, and you've helped us both on many occasions. So let's talk about, you mentioned a few different roles in the operating room. You mentioned scrub nurse, you mentioned circulating nurse. I know that at one time you were the supervisor of the Monterey Doctor Surgery Center. So you had all these people working for you. So let's talk about and teach people what, say, a scrub nurse does. What does a scrub nurse do?
Scrub nurses are very important to the surgical situation. They spend a lot of time pre-op setting up a back table full of instruments and organizing them just so that the surgery can flow, hopefully very smoothly, and that they are certain that they have everything they're going to need for that surgery. The doctors have preference cards where they give them tips on what they like and what they want to have, and good scrub tech does that. They try and fine-tune it to that surgeon that's in there. And
so I know that Joni, even though now I do plastic surgery, I don't do heart surgery anymore, but I did when I was training, some really big operations will have more than one scrub tech or more than one scrub nurse, right? Because there's so much action.
Right.
And you can have the pump tech with the hearts, and you can have the scrub tech, and you can have a scrub nurse, in addition to the circulating nurse. So there's a lot of action in the operating room.
A lot of action.
So the scrub nurse or scrub tech actually is right there with the surgeon helping with the operation, right? Now let's talk about the circulating nurse. What do you mean by the circulating nurse? How is that job different?
Circulating nurse does not approach the sterile field. The sterile field is the area where the scrub tech, the surgeon, and anybody that's assisting actually in that surgery is dressed in sterile attire. They only touch sterile equipment or that sterile field, which is typically the blue draped field. And the circulator stays away from that field and provides, first of all, she brings the patient in, makes sure that the patient's comfortable, safely positioned. She's really important in that respect, to make sure that everybody has what they need, and when they put the patient to sleep, she assists with that. And then when the surgery's ongoing, she is a gopher sometimes and goes to get whatever they may not need. She does all the documentation for the surgery, very important as well, and very in tune with what's going on with the patient.
Well, Joni, you know that it seems to the public the surgeon is, of course, gets the credit in the operating room and seems to have the stress and the responsibility, but I certainly know that a lot of it depends upon the scrub nurse or the scrub tech and the circulating nurse. Now, I think contrary to popular opinion, when my scrub nurse or my circulating nurse isn't on the ball, I don't tend to throw instruments, but certainly it can get tense. And I know that the nurses are terrific, and when I don't have their help, things just don't go as smoothly. Isn't that right?
That's correct.
It's really a team.
That's right. It's truly teamwork. That's what gets you the best surgery, the best outcomes.
Now, that's true. Now, Joni, let's go to the second part, the initials I see. After CNOR, it says RNFA. What does RNFA stand for?
RNFA stands for Registered Nurse First Assist.
Okay. So how do you get to be... First assist means that you're actually working close, not only physically close to the surgeon, but you're actually working together.
Correct.
That's the first assist.
Correct.
Right? It's like the first mate on the ship.
Right.
Right? Or the co-pilot. Mm-hmm. So how do you get to be an RNFA?
Well, first of all, of course, you had to be a licensed registered nurse. And you also have to have your, the state of California requires you to have your CNOR certification as well. Advanced life support, BLS, basic life support. And then you're required to take a higher education didactic course. And it's a course of throughout the year, part of which is didactic training in the classroom. UCLA offers a course. New Mexico offers a course. There aren't very many. And then you, if you can get a doctor to mentor you through, you have to get 150 to 200 hours of OR time of doing the skills and the training that they taught you in the course.
Okay. So, Joni, speaking of OR time and being in the operating room, tell our listeners and our viewers what it's like to be right there doing an operation. Is it tense? Is it fun? Is it relaxed? Is it uptight and, stressful? What's it like for you?
Well, for me, it's awesome. It's not tense. There are tense times. There can be tense times. But I think it's teamwork. And if the team's doing their job, then it's relaxed. And hopefully you know the surgery that you're doing and what to expect, and the surgeon expects you to know what is coming next and to anticipate his needs. The anesthesiologist is there, and he's doing his job. I think that it's a fabulous experience. Once that patient's draped, it's all about your surgery and what you're doing.
Well, Joni, as I mentioned, and many of our viewers and listeners know, that I am lucky enough to be able to work with Dr. Doug Sunday a lot. We do all our big cases together. We do our microsurgery together. We do our breast reconstruction together, and replants and complicated cases, etc. And you're right there with him, and then, of course, I benefit because you're helping me too. And it is a team effort, don't you think?
Absolutely. And
there are certain skills that you learn during your training. Some suturing you can help with, some dressings you can help with, the instruments and various procedures that we do in the operating room. So, Joni, tell me what some of your favorite procedures are in plastic surgery to help with. Do you have operations or procedures that are your favorite and some you don't like as much, or do you just enjoy going to the operating room?
Well, I enjoy going in the operating room, but I have to say I really enjoy breast reconstruction. I think that's my favorite. It's a long surgery, but there's a lot of action that goes on, and you don't want to be in the way, you want to be a help, and so there's a lot to do. And as you mentioned, you're there's 2 surgeons involved in that. It's a huge surgery. And it's just I think it's the continuity of care that's also so rewarding to see. Yeah,
Joni, talk about continuity of care. One of the things that I really admire about you, and I respect plastic surgery nurses for, is because you get to see them in the office, mm-hmm. right? And you help prepare them, and you can talk to them and help evaluate them. You're right there with the doctor. and then you help them get ready for the operation, and you're there with the surgeon in the operating room, and you get to help take care of them in the office afterward. And I know your patients find you, or I should say, I know Dr. Sunday's and your patients find you a huge asset, and it's really, I think, contributes to their sense of well-being and how they feel about what's going on. Do you find that?
It's a familiar face for them, since you do see them pre-op, and they know that you know a little bit about them. They know you're a familiar face, and so it tends to be comforting for them. And the continuity of care is, I don't know of any other role in nursing where you can do pre-op, intra-op, and post-op, or even if you're a floor nurse, you do your day shift, but then you never really know how they're doing afterwards, and that's really important to most nurses. I think they have a passion for what they're doing and care.
Well, Joni, you know, as I've said, I think you're terrific, and your patients really value you. And looking back on your career, as soon as you finished nursing school, did you go to the operating room, or did you go to the floor, or?
I was a float nurse.
Well, so teach our audience what a float nurse is.
A float nurse is one that fills in when they have absentee nurses, and so you go to all. You could be nursing pediatrics one day, nursing ICU the next day. You could be general med-surg nurse, and the beauty of that is you learn so much. You get to do so much instead of just going into one specialty.
So you worked for a hospital, or you worked at a hospital?
I worked at a hospital.
As soon as you finished your training. Now, how does it that some nurses work in a doctor's office and some nurses work at the hospital and they're on the nursing floor, but they don't go to the operating room? I mean, how does a nurse choose? Is she just assigned, or she has to apply for a certain position?
You have to apply for a position, and generally speaking, the operating room is pretty select. They take nurses that have been nurses for a while and have experience in floor nursing and so forth. And it's a special training just to be in the operating room itself. Circulating scrub nurse, very special training. I would say it takes a good year to, once you're even in that specialty, to get to meet the expectations. It's a sterile area. There's so many doctors that go in and out. You know, there's a lot to learn to keep all the doctors happy and your coworkers. It's an exciting place.
Well, Joni, not everybody really wants to take on that kind of responsibility, and I know not everybody's as good at it as you are. Now, tell me what it was like to be the nursing supervisor at the surgery center. What was that like?
Whoa. Well, that was a lot of fun. That was an undertaking, I have to say. Had a great staff, great group of doctors. I have to say the doctors are very supportive, and that made a huge difference. Fun to work with. They loved where they were. They treated the staff really well. And I think if you have a happy staff and you have a happy group, it's a great place to be.
Yeah, and you were responsible, at least you supervised, not only the instruments in the operating room, but the recovery room as well, right? And you just had to make sure that the building was squared away. And then there was, of course, the whole front office where people came in and registered, and there was all that paperwork and all that stuff. It's a lot of action to supervise.
A lot of action.
It's a lot of action to supervise a surgery center. And Joni, you're so good at it. So tell me, we've only got a couple minutes left, but tell me now what your average week is like. What do you do now as a plastic surgery nurse?
As you mentioned, I work for Dr. Sunday exclusively, and he is in the operating room 2 days a week, and the other 3 days a week he's in the office seeing pre- and post-ops. Pre-op, we interview and assess the patient, try to see what their expectations and their needs are. And post-op, we do dressing changes, assessment of their emotional status, you know, how they're doing with the post-op recovery process. Do they have any special needs, or are they cruising right along? And I should mention, pre-op, we do a lot of teaching. Dr. Sunday and myself want it very clear what the expectations are of that surgery. Some are just very simple little guys, and some are, you know, surgery 101 or surgery advanced.
Right. Now, Joni, I want to make clear to our viewers and listeners, now, if you become an RNFA, that's different than becoming a PA, right? Or
Correct.
a physician's assistant.
Correct.
Although sometimes they seem to be interchangeable in terms of becoming a first assistant in the operating room. It's really different training, correct?
Well, the PA can be a first assist. In my class, we had several nurse practitioners that were doing first assisting. I'm not sure. I imagine that PAs have to take the RNFA class as well. It's a first assist course. And my certification is RN first assist. Theirs would probably be PA FA. I don't know. But they are have more training than the RNFA, of course.
Well, of course, and you mentioned a whole new category, or a different category than we've spoken about today, and that's NP, which is nurse practitioner.
Nurse practitioner.
Now, nurse practitioners are a whole other category, sort of another advanced training group within nursing. Mm-hmm. And I know that they're not necessarily qualified or have a license to go to the operating room and assist like you do.
Correct.
So it's different parts of nursing.
Correct.
So, Joni, you're working for Dr. Sunday now, so tell me more. We've got about a minute left. Now, can you tell me a little bit more about your average day in the office as opposed to the operating room? Now, you see patients?
We see patients, it's a pretty busy day, from 9 to 5 or 6. You know, hopefully we're on schedule and it'll be 5. And if they're a pre-op patient, we will see them probably for a half hour. If they're a post-op patient, we'll see them about 10 minutes. And that's just really to check on them, make sure they're doing okay, do a dressing change, check their sites. And then on the operating days, we either start at 7:30 or 8 o'clock and go straight through till we're done. We usually do about average of 4 surgeries a day, I'd say, Tuesdays and Thursdays.
Well, Joni, you know, I know how valuable you are to Dr. Sunday, and your patients value you as well, and I really appreciate you coming on the program. I feel like there's so much more for us to talk about, and I wonder if you'd just come on back another time.
Well, okay.
Joni Dorey, CNOR, RNFA. Joni, that's a lot of letters after your name, but I sure appreciate you being here. Thanks so much for coming on the program. Now, I have a little announcement. If there's time, I hope my producer lets me say this. The Monterey Wharf Association is going to put in a skating rink in front of the wharf in the back of the old Doubletree Hotel. Now it's called Portola Plaza. And the skating rink party is being kicked off tomorrow, and they're going to have live music. So we know what that means, Joni, right? So go down and strap on some skates. There's going to be a skating rink right in back of the Portola Plaza, which we used to call the Doubletree, for the whole holiday season. So thanks very much for being here. I am Dr. David Morwood, a board-certified plastic surgeon, and this is Your Health radio and television program. And that was Joni Dorey. Joni, thanks very much for being here.
You're welcome.